School nurses are often underestimated, but they do far more than bandage boo-boos. These nurses bring healthcare to under-resourced communities. On the social media platform TikTok, teens have jumped on the viral school nurse trend. In hyperbolic videos like the compilation below, students poke fun at school nurses for using ice and bandages as panaceas to treat broken bones and resurrect dead pupils. While this meme earns laughs at the expense of school nurses, these videos do point to some broader issues. School nurses are often underfunded, which means they may have to make do with basic first aid tools, like ice packs and bandages, when their students would benefit from more resources. In fact, 25% of U.S. schools do not have a school nurse at all. These deficits highlight the essential role that school nurses play in children's healthcare. As of 2020, Tennessee funded 1 nurse per 3,000 students. The national recommendation is to hire 1 nurse per 750 students. Districts with fewer school nurses report higher rates of tardy and absentee students. Without a medical professional to consult, sick students in these districts have 2 options: tough out their symptoms in class or have their parents take them home. For a state like Tennessee, bringing in 1 nurse per 1,000 students could help students receive the care they need. This school healthcare would come at cost of $39 million. But what are the costs of not having school nurses? To determine the value of school nurses in their communities, one must first acknowledge the nurse's long list of responsibilities. Soothing scrapes and taking temperatures are just the tip of the iceberg. Or should we say, ice pack berg. School nurses dispense prescription medications and help monitor students' symptoms, both of which are crucial for the 1 in 4 students that have a chronic illness like asthma, diabetes, or an allergy. School nurses can provide a respite to struggling families. In impoverished areas, many families may not have access to laundry facilities, showers, or menstrual products. Some school nurses have the funding to install a shower or a washing machine in their office for students in need. Nurses without these resources can point parents toward community organizations or services that can support these hygiene needs. For the many students who miss school because they don't have access to pads or tampons, a panty liner from the school nurse can be a ticket to continuing their education. Of the adults in the U.S. who are afraid to seek medical treatment because of healthcare costs, half were parents. Children growing up in these financially at-risk families may not have the opportunity to visit a doctor. For these students, a school nurse may be their primary source of preventative care. Alongside this routine care, school nurses are important sources of reliable health information.